Hello, hi. Good afternoon to Max Foundation staff members. Thanks for inviting me here, meeting. And of course, a very good afternoon to all of you here. I'm Paylin, the pharmacist in UM Medical Center. Today I'll be talking on almost the same topic as Dr. Haris, but in a different perspective. Second part of how you can help to manage your medicine efficiently at home. So without further ado, I'll just start. Maybe if I can pose you this question, what do you think, why do we need medicines for? Maybe I can get a few responses. What do you hope to achieve by taking medicines? Cure? Some more? Sorry? A relief, yes, definitely. Okay, so basically I think all of you would have agreed with one of these points here. We need medicine. First of all, of course, we want to fight against the disease. Okay, we want to be more functional, right? We want to be at work and all that. We want to get better. Okay, we want to have prolonged survival. Okay, we also want to feel comfortable, and we want to control the disease before it goes to end stage. That's why we will take medication. But the fact is, with all that good intentions, but these intentions can only be achieved if you are taking it the right medicine, at the right dose, the right form, the right method, and provided the medicine is in a good condition. In this case, it's always the medicines that you are dispensed with and not something that you take without the pharmacist or the doctor's prescription. So talking about safety in medication management, who is involved? Not you alone, okay? The physician, the pharmacist, and yourself. So we here have very unique relationship, okay? We need each other in order to achieve the treatment goal. So we should work hand in hand, just like the picture there. Now just a brief introduction of our role here. The physician, of course, they will look at you, the diagnose, and then they will prescribe what medication you need. Where the pharmacist will work alongside, okay, to prepare your medication and to dispense, and of course to give you counseling if you need. And last but not least, your role here is definitely to take according to what is recommended by the doctor at the right time, the right dose, and all that. While we are playing our roles, we cannot avoid sometimes errors can happen. Okay, I think we all agree with this. And again, this is not just error at home where caretakers or patients are confused, but sometimes it can happen from the start of prescribing to the matter that it could be a mislook of diagnosis or things like that, or it could also be the nurses giving you the intravenous treatment when you are in the ward or daycare, okay, in terms of different drug, different dose, different patient, okay, and also pharmacies. We do have errors happening as well, where we print the wrong label, give you the wrong instruction and all that. And last but not least, if at home you are new to a medication, or most of the time someone is taking care of a medication, you may have taken it at the wrong method you should be as well. So I would like to share with you this paper published by the Star Online last year, September. The topic is reducing medication error. So the Malaysian National Patient Safety Council defines medication error as any preventable event that may cause or lead to inappropriate medication use or patient harm while medication is in the control of all of us here. It continues to tell us that medication errors can be committed by anyone, okay? Just like what I pointed out earlier. And medication errors are of different types. It can be prescribing omission, that means they forgot to write something else for you to take at home, the wrong timing, unauthorized drugs, the dosage form, the technique, and the monitoring required. So let me just summarize. In this paper, the keywords here are medication errors are preventable. That's why all of us here, if we know, we can detect and we can avoid, okay? And then, of course, talking about patient harm, this is something which we don't want. So we have to work alongside together. This is another paper which I wanted to share with you. Was published last year early last year by a group of nurses. Okay, they were talking about medication errors among nurses in government hospital. So the conclusion from this study shows that it's not that the errors happen because they don't know what they are doing. Okay, in fact, 54% of them have medium level of knowledge, and 46% of them have high level of knowledge. So why then medication errors can happen? Well, the main root causes are the heavy workload and the complicated orders sometimes, okay? And then other causes could be that the nurse is a new staff or personal neglect, and less than 50% is unfamiliarity with medication. So if I can just extrapolate this data, it actually be the same root cause for pharmacy. Okay, sometimes it's not because you don't know what we are doing, it's just a lot of things around us are affecting. So, okay, then moving on to another paper. This is the last paper I wanted to share with you. It is in a primary care clinics, okay, where you go to the GPs and all. Errors also happen over there, where in this case, in 12 clinics that they've conducted the study, okay, 3.6%, very small percentage, is just diagnosis error, while bigger chunk, like 53.2%, is due to management. And 40% had potential to cause harm, and about more than 90% can actually be preventable. So once again, all these studies that I share with you, I hope you have some idea how to manage and to detect and avoid medication error at your level. So it happens anywhere, anytime, and can be anyone, due to lack of communication sometimes between the doctor and yourself, the doctor and us with you, okay? So what happened is, of course, if there is such a lack of communication, we really hope that you can just let us know if you need more information, or sometimes just don't feel shy, because I have come across a few patients. I haven't finished talking, they are ready to go. So I really hope, yeah, this is one thing, when you come to UM Medical Center, I know parking is a problem and waiting time is long, but if you are really on certain medication, especially new medication, please spend some time with us, and if you need further information, let any one of us know. And of course, medication errors happen also sometimes nowadays. A lot of medication in the market, they look alike, they sound alike. Okay, just like your Maggi Mee, your Ibu Mee, they just sound alike, look alike, right? Sometimes in pharmacy, we may have given you the wrong thing. And then medical abbreviation, the short forms. Okay, sometimes in communication with you, we may have said EOD, or actually, what is that? It actually means every other day. Okay, so if you are unsure, sometimes just ask. And then last but not least, yeah, the prescription confusing directions. So within your control as a patient, there are a few tips how we can avoid errors from happening. This is what I got from the FDA, US body for Food and Drug Administration. So first, you should know the name of your medicine. So if I pick one of you here, can you tell me your medication? Maybe one of you here on this table? Okay, never mind. So anyway, the first tip, of course, to know the name of your medicine, and then to ask questions if you're unsure, to know what your medicine is for, to read the label and follow instruction, to keep your pharmacist or your doctors informed of your well-being from time to time, and of course, to keep a list of your medication. So this is a local government campaign, Know Your Medicine launch, for you to remember 5R, okay, using your hand. It must be the first thing, right drug. First R, okay? The next one will be right dose, right route. That means the way of taking, whether it's oral or intravenous, right time, and the right person. Knowing your medicine also, you need to know what to do if you miss a dose. So usually, whether or not you should take another dose really depends on how long the dose that you miss is overdue. Like for example, if you are on once daily dosing, you usually take at 8 a.m. You only remember at 10 a.m. 2 hours later. So by all means that you can repeat another dose. However, if the dose is near to your next dose, that means you only remember that night. Do not take that dose anymore and just continue the next day dose. The golden rule here is do not double your dose. Okay, I think you all kind of know this also. Know if any monitoring is required while taking the medicine, whether there's a tendency of bleeding, and therefore look out for any bleeding in the gum or things like that that you need to report. You should also know the warnings or precaution of the medicine that you are taking. Like for example, if you are a woman of childbearing age, whether that medicine will actually affect the risk of pregnancy and things like that. Okay, and the last 2 points, knowing the side effects and interaction, I think this is almost the hot topics now. So I'll talk more in the next slides. So side effects unfortunately is applicable to all medicines. There's no one medicine that has got no side effects, okay? So, but the properties is they are categorized into 3 types. Very common, it can happen 1 in 10 patients. Common, it can happen in 1 in 100 patients. Or uncommon, it can happen in 1 in more than 1,000 or even more patients. And it can also vary by individual. Okay, Encik A will get it, but Encik B may not get it. Okay, it varies by individual. And then also it's most of the time temporary and reversible. That means once you let us know, or the doctor can actually do something to reverse it. Okay, and if the side effect by all means is very severe, they may consider those adjustment, those interruption, or those discontinuation. But the take-home message here definitely is reporting. If you have anything, just let us know. Reporting is the key. So if the medicine has got so, well, maybe a list of side effects, why are you still taking? Do not forget that medicine also has its benefits. Okay, so if the benefit outweighs the risk, okay, it's also something that you should continue taking while your side effects are being monitored. Okay, so that is the ideal situation that we want. Moving on will be the drug interactions. We know every medicine has its own structure, its own chemical groups, or be it their genes, okay? So, but it is not just limited between medicine A and medicine B. It can also happen medicine A with certain food, medicine A with certain plants or herbs, or even alcohol. Okay, so later on, if you have anything you suspect that may have interaction, maybe we can discuss during the Q&A. Interaction between substance, what will happen if, as such, it will usually increase or decrease the amount of your primary drugs, okay? So, and also, just like side effects, it can be mild, it can be moderate or severe. So if you are taking something that can cause your Gleevec or your primary drug to reduce in terms of amount in your body, so that may translate to reduction in efficacy. That means we do not achieve the treatment goal. Okay, but what if you take something that interacts and increase further the amount that we intended? So then there will be risk of toxicity, adverse reaction or unwanted effects, or in severe cases, possible impairment of the organs and functions. However, the good news is if, again, an interaction is identified, detected early, it is usually reversible by us suggesting that you don't take them together or stop it completely. The next tip is, of course, you should ask questions if you're unsure. Always get clarification on medical terms, anything that you don't understand on the prescription. Okay? And also do not hesitate to express concern. Especially, I have a few concerns when I dispense Gleevec. They will say the tablet is so big, 400 milligram, I cannot swallow. So that is their concern. So usually what we do is we will suggest either that they can disperse it in water or apple juice, okay? Or in other way, they can actually see the doctor to change it into smaller dose, divide into 2 divided doses. And also be interested in the disease and other treatment options. That means you take charge of your disease and you know what is the alternative. Next will be know what the medicine is for. You should be familiar with your medicine profile, know what to expect from the medicine, okay? So just a simple abbreviation, simple example here is if you take Panadol, you know it's going to reduce the pain. Okay, so you should actually find out more about your medicine and so that you know what to expect. And if should there be anything that is not supposed to happen, you will also know first and report. Read label and follow instruction. I always tell my patient, treat us like a bank. Okay, before you leave the bank, you will check everything. Okay, so you go through the information on the label before you leave the pharmacy. Okay, of course, the main thing is if you are Encik A, you must make sure that the labels is Encik A. Okay, sometimes we may have mixed up the basket and things like that. It may end up Encik B's medicine in your hands. Okay, so that is the main thing you should look out for. And then our labels are all in Bahasa. if by any chance the person you are taking care of or you are the one taking the medicine feel more comfortable with any language that you feel you will understand better, you let us know. We have Chinese, Indian, Malay working in the pharmacy. We can always do the translation and you write on the label. Okay, because sometimes when you go home, you will forget what we tell you on it over the counter and you can still double check on the label. Okay, so whenever you cannot remember anything, please check, do not assume. Okay, and then take according to our recommendation. Before or after meal is actually important. Okay, before meal will just mean that we don't want your medication, for example, to interact with fats, because if you take with meal, sometimes your meal contains oil. Okay, so that may affect the efficacy of the medicine. Or why do we want you to take after meal? So that you don't have any gastro disturbance that may actually be coming from the medicine itself. Okay, and one thing here is to avoid grapefruit for certain drugs. Okay, because it contains certain enzyme that once again can affect the efficacy of your medicine. So always keep us informed. Also, in particular, if you have any specific allergy. Okay, because allergy reaction can sometimes be life-threatening, serious. So we need to know if you do have. Okay, so that we can always give you the alternative. And also inform if you are taking other medicine and to keep diary of any doubt so that when you come again for the next appointment, you know what to ask and what you want to know further. Last but not least, to keep a list of your medication. This will include all your supplements, all your vitamins, herbal remedies, over-the-counter products, traditional medicines. Okay, because sometimes when something happens to you, what we have in the hospital record is just what we give it to you and not what you have at home. So sometimes it will help us if we know the whole thing so that we can rule out what have caused what happened to you. So in summary, if I can close here, I would like to tell you that every medicine, don't worry, it has its benefit as well as its risks. But what can we do is we can work together as a prescriber, the pharmacist, and the patient, and be more actively involved. I would say whenever you come, maybe bring someone along with you. Okay, spend some time with us. Yeah, we can actually tell you more about your medication, your disease, and have the continuous communication between patient and healthcare providers. Okay, meaning to say sometimes you come once and then the subsequent you always ask your caretaker or your son, your daughter to come. Sometimes when we ask you say I'm the daughter, I'm the son. So it's very hard to have that continuous communication with you and to catch up with you. So this is something maybe we want to highly recommend that you spend that time and the effort with us. Okay, these are the references. And with that, I thank you.
All medications that are prescribed in the hospital, they will give the name of the medication on the label. But I am quite worried if you go to clinics, they will just say, makan bila sakit or something like that. They won't tell you the real medication. Yeah. So how do you go about, sometimes we ask them because it's not a proper nurse that will dispense you the medication. The doctor has prescribed and he just wrote down, but they will just give the label and say, this one untuk menahan sakit, but never tell what kind of painkillers are there, So we don't know our medicine, the name of the medicine. Like you said, it's very important for us to know what medication you take.
Okay. Well, there are a few things here that we can do because, of course, it's beyond our control what the clinics practice outside. But what you can do, maybe if your medication is coming in a blister form, where you have to remove it from the foil. Usually, on the foil itself will give you the name of the medicine and also the strength, everything, including the company that produces it. That is one thing. But if it comes in a loose form that you don't have any information, you ask them, it is your right to know. They don't write it for you, you write it yourself. I would suggest that. Yes.
I have only one simple question. I suppose everyone here also will have this question, but maybe they thought it's not important to us. But I would like to know, when you are given some medications are to be taken after food, after meal, and some before. How long before and how long after meal that we should take this
I think that is really a good question. Usually for before food, we will say 2 hours before your food. If by any chance you terlupa, you dah makan, after 1 hour you can take it. That is if the original instructions is to take before food lah. Okay. If it's after food, okay, so long that you feel you are full. Okay, that means you don't feel any hungry pangs. That means I would say after food definitely is after your main meal. However, if you do not have a main meal or you already passed your main meal long time ago, you can just take anything that you feel can support your stomach. So long that you don't feel the emptiness is good enough. Too soon after you take your too soon you take your medication after your lunch is also not good. Usually we say half an hour to 1 hour after. Okay, so that your food can be digested and all that, and it's the enzyme that will help your medicine to be absorbed.
Excuse me, I want to ask about the medicine. Do they have most medicine has expiry date, is it? And how do we know actually? Because some of it is not labeled. They give loose medicine. We don't know that. And the other question is, if it's expired, can we still take it? And how long is the effectiveness? Maybe 1 week, 2 weeks, or what?
Right, so there are two questions there, right? I'll answer the first question first. How would you know the expiry of the loose tablets that we give you? If it is a short-term medication, that means you can finish it within 1 week or less than a month's time. Usually it's not written because the person who do a double checking will have checked it for you. But if you're taking it for a long term, okay, that means you have to take it for months. You ought to know by first asking, okay, because sometimes it is not a compulsory thing on the label for expiry, unfortunately. But of course, please ask, okay, the person will let you know. But if not, then you can always ask for blister packs packaging. Because what happens right now in our pharmacy, 80% of medicines are all blister packs. 20% are left loose. So sometimes if you don't want the loose, you can actually ask for blisters. If we have, we will give it to you. That expiry is definitely on the packs. So how long after expiry is still safe to use? Usually for oral medication, we say 6 months, but we don't recommend because we do not have any data to tell you whether it's as effective. When I say safe, it's just that it won't give you any effect. That means any side effects, diarrhea and things like that. No, it won't happen. But whether it will really contribute to your disease control, something that we cannot comment on. But yeah, 6 months is safe.